Hello, I'm Rick Crawford with the first installment of the Crawford for Congress campaign update. This is just one way for me to relay some of my thoughts to you each week about issues facing our nation and the people of Arkansas's 1st Congressional District. I hope to cover issues each week that are pertinent to you and how I believe they could impact your life. This week, healthcare reform legislation currently under consideration in Washington, D.C., in both the House and the Senate. First and foremost, I firmly believe healthcare delayed is healthcare denied. The legislation currently being debated on Capitol Hill would necessarily cause chronic delays in access to healthcare, which could have dire consequences for those with immediate needs. Can the federal government effectively manage a healthcare plan that administers timely and relevant treatment for all Americans? Based on their track record of management of other federal programs, like Social Security, for example, I'd have to answer no to that question. The healthcare plan in question does little more than expand the federal government and threaten the sanctity of the doctor-patient relationship. I fully acknowledge that our healthcare system needs some reform, but I believe the best course of action would be for the federal government to facilitate improvements and reform in the current system and let the free market correct itself under federal oversight. It would be next to impossible for private insurers to compete against the biggest provider in the country, a U.S. government program. This measure is also extremely cost prohibitive and would only add to our astronomical national debt and create even more severe long-term consequences than we can imagine. As I've said many times over the past several weeks, there are 4 key questions I would ask myself when considering any legislation should I be elected to serve in Congress. Is it constitutional? Can we afford it? Is it necessary? And have I read the bill? The House version of this bill was released early this week, and it's over 1,000 pages long, so I'm not sure how many legislators have had an adequate amount of time to actually read it. Legislators should take caution, tread lightly, and not rush into a bad decision. Thanks for listening, and we'll have more from the Crawford for Congress campaign next week. Until then, I'm Rick Crawford, and I approve this message.